Understand what we're doing is until the shelter in place is over, we will keep the doors locked. We are seeing patients on a very limited basis, and that, per the letter of the law, is where we need to be. We are using personal protective equipment. We've got everything we need to make sure that everybody stays safe when they're in the office. So what I want to talk to you about is what the next 2 weeks look like, and then after shelter in place is over, what that looks like for you in our office. And we'll keep this going over the next couple weeks. I'll even give you some demos as to what to expect, because it's different, it's weird. There's a lot of bad information out there. What you need to understand is chiropractic can handle emergencies. And I want you to think of it this way. If you're experiencing some type of malady, regardless of what it is, where it's impacting your daily activities. For example, if you can't go to the bathroom by yourself, if you're having a hard time driving, if it hurts to get anything during your day done, if you're leaning on medications to control pain, those are emergencies, and we can help with that. We are focusing on our current patient base. We do not have any walk-ins. If you've been a patient in this office, you know we really don't do walk-ins. So to qualify as an emergency, call the office and we'll interview you. Once you've qualified from a chiropractic point of view, then we'll get you in. I am seeing patients Monday through Thursday in the afternoons. Mornings are reserved for virtual consults. And of the virtual consults we've been doing, it's really handy because a lot of things we can do virtually. For example, we can go over test results, lab work. We can have a conversation about things. We can do all that virtually. And I've been doing this long enough to be able to help you through your supplement routine, make some dietary modifications, so on and so forth. So that's easy to do virtually, and we're more than happy to do that. It's actually a lot of fun. And one of the other advantages of doing a virtual consult is they're recorded. So you get a recording of your consult after. But one of the things that's cracked me up about this is if you've been on social media through this, you've probably had a few panic attacks. And I love the meme lately that says that this virus is so smart that it can differentiate between a salon, a grocery store, and a massage parlor. So a little bit of humor for you. There's a lot of different camps in Michigan right now. And on one hand, you've got those of us that believe that this whole thing is a scam, and it's all BS, that this was all made up to infringe upon our freedoms. On the other hand, there's those of us that think this is serious or more serious than a heart attack, and that this is going to take out millions of people. Somewhere in the middle, there needs to be a voice of reason, and that's the stance we're taking. So appreciate that while you can be strong, you can be tough, you can be healthy, and hopefully that's where you are. But I'm going to tell you statistically that about 75% of Americans are not healthy enough to handle this type of immune challenge. So it reminds me of an old Chinese saying, the strong warrior says to the master, Master, I don't see what the big problem is. A strong warrior is not afraid of a little rain. And the master says, of course not, but a wise warrior knows when to get out of the rain. So that's kind of how we're looking at things. Rule number one in the office. Rule number one, we have to limit our total exposure. So we are limiting how many people are allowed in the office at any one time. Right now, doors are locked, so if you're here, we'll text you or call you and let you in. Your temperature will be taken at the door. If you pass, you will be put into a room that's been cleaned and sanitized. You will stay in that room. Doctor will come in. You guys get caught up, get treated. When you leave, feel free to wash your hands or swap out your PPE if you need to, and we can do a contact-free checkup. If you need supplements, phone them in. You can use the web store, and we will do curbside and contact-free delivery, no problem. Now, after the 18th, door will be open, but we're still going to control who's coming in and who's not. We've created a social distancing space in the office. We can handle up to 4 people in the reception area. However, we're going to be very clear in how we move patients through the office. I did see Dr. Cruz today. He made it across the border without trouble. So my understanding is Dr. Cruz will be back in action sooner than later, and we're going to arrange schedules to maximize the amount of people that can be seen in a given time. As far as doing your part, we see some pretty sick people in the office, and a lot of them are on medication that reduces their ability to fight infection. Some of them are transplant patients, some of them are cancer patients, and some of them have autoimmune disorders. We're going to take care of that. We're going to create clean environments, and our goal is to keep those people away from the more general population that chiropractic is used to treat people with. So we're working really hard and spending a lot of hours organizing how we're going to arrange patient care in an in-office setting. That being said, the easiest way to maintain continuity of care is to go virtual. So call the office, set up a virtual consult. At this point, we will call you if you're trying to make an appointment. Once shelter in place is lifted, then we will start taking appointments on the book again, and we will make sure that everybody gets in a timely manner. And one of the things I've been noticing for people that haven't been adjusted in a few months is when they do get an adjustment, all the lights go back on. That's what I want you to experience. So right now, we're going to be all hands on deck for good chiropractic care done in a clean environment, and we're ready to go May 18th. In the meantime, just be considerate to everybody. I know masks are crazy. They are. But everybody wants to do their part. I have, ironically, deleted Facebook off my phone, so, this is kind of weird. To be clear, in our office, we have always had a no sick policy. So if you're expressing symptoms of anything, you're not coming in, to protect all our other patients and our staff. To be clear, chiropractic can't be done virtually. So that's why we have to have this talk, because I need you guys to get adjusted, and you need to be adjusted. As far as massage goes in Michigan, that's shut down until May 28th. As far as all the other services that my other providers offer, we are taking that on a day-to-day basis. But telemedicine is available. So I've been doing telemedicine for, as long as it's been able to be done, for over 10 years. And the good news is we're really good at it. So take advantage of it. With that note, we have done everything we need to do as a group to secure all the supplements everybody's been flying through. All right, so it helps to know some people, and we are well stocked with everything we need. So any appointment that is on the book for May 18th and after, those are staying on the book. Okay? We're going to keep your appointments for May 18th and after. I'm not touching those yet. So if you have an appointment May 18th or later, thank you, Monica. If your appointment is booked May 18th or later, those are staying for now. As far as we are told, that's what we're doing. As far as muscle testing virtually, Lynette, there are things we can do, and you and I can talk about that individually. But yes, we can do some screening virtually. As far as what this summer looks like, I'm going to share with you that I have adjusted my entire summer around being in the office. So expect to see me a lot more in the office. Obviously, travel has been suspended, and all of the events that I normally give on a every other week basis are now canceled or are being done virtually. So I'm going to be around, and I do look forward to seeing everybody, getting the team back together. We're going to get the gang back together, and our team is ready to help your family weather through this and get back to life. So stay tuned. Check out Facebook Live. Open your emails. If you're not getting emails from us, check your spam bin. If you want, call the office. Give us your most updated email. Let us know, because that's how we're communicating with you. Like us on Facebook. Check out our YouTube page. It's Innovative Health Solutions. I have unlocked a whole bunch of unlisted videos for you to peruse. A lot of stuff that is doctor only. So while you have the time, if you want to know a lot more about kind of why we do what we do and how we do it and what it all means, there you go. But now's the time to get educated, get caught up. And I want to leave you with this, that obesity is the number one risk factor right now going forward. And as we reopen the country, if you are an at-risk individual, it's still recommended that you shelter in place. So one of the things you have control over if you are an obese individual is obesity. Now is a good time to work on that if that's your only risk factor. And the alarming statistics right now you can find from a February study show that roughly 38% of Americans are considered morbidly obese. And if you do all the math between obese, morbidly obese, and overweight, roughly 70% of the country is at risk. So if we want to have a real country to come back to, we got to double down as residents of the United States and say we need to have a stronger, healthier country so we can lead by example through this crisis, come out on top, and be better than ever. So that's our goal. That's what we're headed for. Bigger, stronger, faster. That's always been my goal. And we have all the tools to help you do that. So look forward to seeing everybody. Get out, enjoy the sunshine and the bipolar Michigan weather. Stay hydrated and be good to yourselves, and we'll chat soon.